you can legitimately see, oh my God, you're deficient in this mineral. You're deficient in this vitamin. And listen, you mentioned vitamin. Most common vitamin deficiency in guys, vitamin D. So I'm a huge proponent of taking vitamin D. I forget sometimes, but it is huge.
Welcome to HKB Uncut, the health, knowledge, and beauty podcast.
On this show, we unpack the newest techniques and trends in cosmetic surgery, how to tune out the social media noise to make empowered decisions about your appearance, and what you need to know before you book a procedure.
I'm Dr. Bill Kortesis.
And I'm Guarav Bharti. We are board-certified plastic surgeons and co-founders of HKB Cosmetic Surgery, an award-winning practice with 11 locations across 6 states.
In other words, when it comes to aesthetics and cosmetic surgery, we've pretty much seen it all, and we want to share our knowledge and unique approach to aesthetics and beauty with you. Whether you're interested in cosmetic surgery for yourself or want to separate fact from fiction in the plastic surgery world, we hope you'll tune in each week. Thank you so much for tuning in and being a part of our podcast. Today's episode is on the men. Do men have plastic surgery? Do they need plastic surgery? Why is it often under talked about? You know, let's break down some of these myths, on men having plastic surgery.
Yeah, well, I mean, at the end of the day, we age just as hard as our opposite sex, so we're definitely getting aesthetic surgical interventions. And at the end of the day, you know, the goal is to still, look elegant, look natural, look masculine, and it's gaining a lot of traction. I will say, though, that in the past, maybe not so much. Maybe it was even almost looked down upon. But now I feel like, you know, male aesthetic rejuvenation is commonplace.
What percentage of, do you think your personal patient population, practices patient population, where have you seen the trends over the last few years?
It's definitely increasing. I think that it's still dominated by females over males. I would say that the ratio now, anywhere from 20 to 30%. And I think there might be some variability in different parts of the
That's kind of what
nation.
I'm seeing too. And, if you were to say patients are coming in, what are men looking for? Is it the exact same thing that women are? Or what are the most common things men want to address?
Yeah, here's the deal. I think traditionally men were looking at, they didn't like extra fat areas, so liposuction, huge. And then men also have facial concerns, rhinoplasty, under your chin area, eyelids. But more and more now, it's smaller stuff. Skin, making sure the skin looks good. They're also interested in things like bigger procedures like facelifts. What about you? What are you seeing?
I think it's everything, right?
Yeah,
I think you hit the nail on the head, where I think traditionally it was mainly liposuction in certain areas, be it the chest, the tummy, hip rolls, because that's kind of where most men like to keep their fat deposits is in those areas. But it's really expanded right now. Our male patients want all the facial aesthetics that we can offer, from facelift, brow lift, eyelid surgery, you name it. They kind of want it all. To now they're going in and actually getting our services that our estheticians typically treat, our mid-level providers that, for Botox and filler and stuff, and they're doing more and more maintenance treatments as well, which is very common. And a common question we always get asked is like, can I still maintain my manliness? Can I still be very manly and get these procedures done? And, how do you address somebody who comes in like, hey, I still want to be a man and have some wrinkles, but I do want to make myself look better?
Yeah, and I think that those are all important points, points that I would, feel the same about. And I think that you definitely can do that. I think, but there is a different approach to it. I think that's the main thing. You have to adjust the actual technique. So the technique is not exactly the same as it would be, in a female. And I think that that's one piece, right? The other is kind of the actual procedure you're doing might be different. Let's just, like, for example, jawline. Giving a male more of a masculinized jawline involves projection, or involves increasing the bigonial, width. And what's paradoxical, though, in that situation, is like kind of women are wanting that now also. So sometimes there are some parallel things that are happening, which is kind of an interesting thing that just kind of happens with trends, and then we'll shift back. Other things are going to be like with contouring. So massive weight loss is taken over, but the world by storm with using these new medications, and so it's happening to men also. So we're doing a ton of skin excisional procedures on guys also, but it's different. What's different, for example, about a male abdominoplasty, a male tummy tuck?
Well, a lot of times, it's scar placement, but it's also how we deal with the waist, right? And women want more curves,
Right.
More often than not in regards to their body contouring. They want to have that shape creation of curves, where men want to maintain their sort of square appearance, right? You don't, the term we utilize in our field is feminizing the waist, right? We don't necessarily want to feminize the waist in doing so with body contouring, excisional skin surgery with male patients.
For sure. And what's interesting I found, which I'm curious to hear what you say, is that guys want to keep stuff under the radar. I think even more so than women. And so when you talk about incisions and incision placements, like when we talk about like the chest, like contouring for something like gynecomastia, where you have excessive breast tissue, almost all my patients are like, hey man, whatever we can do to have the least, if not no scar, is very important. And I think it's interesting. I think we're a little different than women, and I think partly it's because we just don't want to have anybody to think we had anything, because it might potentially affect our perception of us being like masculine and men. But it is really interesting. So most stuff that I do on the chest is typically like aggressive liporesection using energy, but really trying to avoid scar at all costs if possible.
Yeah, minimal scars at best, right? And if you do it in areas where it hides or it blends in with a lot of times you do it around the areolas where it blends in so nobody can actually see the scar, and that works remarkably well.
Yeah, and energy has been really valuable there. Doing multimodal liposuction, ultrasonic liposuction, power assisted liposuction, RF helium based energy afterwards, like Renuvion, and it's really amazing the results that we can get without having to cut out skin. But at the end of the day, if you got to cut out skin, you got to cut out skin.
The thing is, G, that a lot of our patients, including both women and men, are doing everything they can to take care of themselves, right? Yeah. This wellness revolution is happening where they're counting macros, they're watching their steps, they're watching what they eat, they're doing all the exercising, but there's still things, despite all that only a surgeon can take care of, right? So you mentioned one, gynecomastia, right? And like, unfortunately, it just happens a lot in certain subset of the population of men, and it's something that can be taken care of easily, limited scar burden,
right?
And you can get the chest that you want, right? What other procedures are like that for men that, are just not talked about? Because again, to your point earlier, men just don't want to talk about the procedures
I would say eyes, around the eyes for guys. Especially if you're in that phase of like you're maybe middle age, you're more in tune to your health, you're leaning out. You just can't help the age effects that are going to happen around your eyes, and that's the thing that makes you look older sometimes. It makes you look fatigued, and like you're in the best shape you've ever been in. So like taking care of like upper lids, where you remove the extra upper lid skin, that can be done straight under local. Literally, you get rid of it, and you just look like you're refreshed. You're less fatigued, and sometimes it actually improves your peripheral vision because you remove some extra weight. So that's one. The other is lower lid. So I like to approach these two together. This unit. You get rid of the bags. You do a little micro fat grafting to the cheeks to kind of improve that volume here, not to make your cheeks fat, but you think when you lean out, you lose volume in your mid face and you look kind of gaunt. And then the others are a little bit of skin removal and CO2 laser. But I think treating this is a unit that really is like helping guys with this unit is
you
really
can take 10
amazing.
to 15 years off just like that. And again, scars, are they visible to the naked?
No, they're not. They should be undetected, and they fade. But the thing is, they're in places that when you look, you're like, oh, it just looks like a normal anatomic, inflection point. So you don't really see it. Other thing is like, listen, one of the most under discussed thing, what is the most powerful thing for guys, the same with women, but more with guys, is hair. I mean, hair is so important and like literally changes the aesthetic. I mean, what do you think about hair? Like what's how powerful is hair restoration?
Because we see a lot of these patients, and I tell every single one of them the same thing. If you have money and you have downtime, it's a no-brainer.
Yeah. And it's not like crazy downtime. We're like a little bit of downtime.
Yeah, I mean, it's not like a lot of downtime. You just have a bad haircut. No lie, you have a bad haircut for a few days.
And it's virtual, like it's a virtual, like nearly, 100% kind of take rate.
Yeah, it works really well. So you're basically removing hair from a part of the body that grows hair, is resistant to hair loss, male pattern baldness, and you put it into an area
Yep.
that
And there's
is
no
not-
scar.
without a scar burden.
Yep.
And it's remarkable.
And the other thing is there's other stuff that's happening now. So you're like, I don't want to, I'm not ready for that. Well, there are treatments now that are like incredible. There's supplements now that are valuable. We're using Vitrice now, which is really great. Just the gummies that you eat. There is injections now where you can use your own autogenous stuff like PRP. Some people are talking about stem cell therapy. There's also recombinant platelet-derived growth factor, using it in an off-label fashion, but getting remarkable, hair growth. So there's really a lot of things that we can be doing that go into like your aesthetic. And I know you love this stuff. Like Bill's a huge proponent of kind of just aesthetic wellness. Like this is part of that. Like, so for guys and women, but guys are kind of new to the game. There's small interventions you can be doing to control the way that you progress through life, and also to maybe reverse some of the things that have gone on to kind of be at the place that you want to be.
So again, you're a middle-aged man. You're doing all the wellness stuff you think you can do. You hired your trainer. You're watching what you eat. What are the go-tos that you would say right now, top 5 that you're like, you have to do as a male patient?
Procedures?
No, I'm just talking about therapies in aesthetic medicine right now.
Oh, I see. Yeah, so I think that
You named a few, but
yeah,
let's
I think the first is like, man, just take care of your skin. So you need to use 3 things. You need to use a real deal face wash. Doesn't have to smell fruity. It can be just like a normal high quality face wash. It cannot be bar soap. The next is you need to use just a high quality moisturizer in the morning. And then at night, you need to use some sort of active agent moisturizer with like a retinoic acid. Nothing that's weird, nothing that's fruity, nothing that's, too much. 3 things. It's simple.
skincare, number 1. Got that. All right. What else, G?
Number 2, you need to think about what's going to prevent things from worsening. What's going to prevent you from getting really deep wrinkles in your face, but still allow you to move? So I think neuromodulators, okay? Neuromodulators are things like Botox, Dysport, Jeuveau, Latibo. What am I missing? Xeomin, all those products. Those are things that actually just lessen the burden of wrinkles, just so that you don't form as deep of rhitis. I think that's a great thing, and if you don't like it, you don't have to do it.
So wrinkle reducers,
wrinkle reduction. Next thing is going to be, I think, volume. Restoration of volume or collagen. Okay, so that doesn't mean to make you plump and overfilled. It means to promote collagen production. We're talking about primarily facial stuff. So those are things like you can use a little bit of filler, not a lot, just a little. The other things that are really valuable are things like biostimulators. Okay, biostimulators are things that you can inject under the skin that promote your body to develop its own collagen. Radiesse, Sculptra, fat. There's other stuff that's coming like Dermaclay. There's other things that have properties that will stimulate that. So that's the other thing.
Is hair in your top 5 or 6?
Hair's definitely in it. And I think that, you need to do something for your hair to keep it where it is or to improve it. And there's lots of things for hair. There are so many things. It could be its own discussion. But there's pharmacotherapy, which means there's pills that you can take. There's things like low-dose minoxidil, oral and topical. There's Propecia that you can take in oral supplements, a DHT blocker. There is biotin-based supplements. There's Vitrice, like we talked about. There's Nutrafol, like we talked about. There's PRP injections. There is exosomes, which is kind of the wild, wild west. There's some products that are really great, some products that, you don't know really what's in them. There's a topical exosome that we really like using in our practice called Intense by Plated, and it's remarkable, the effects that we're seeing.
I use it personally.
So there was not a single hair up there before this episode.
Yeah, I was bald. I was definitely bald at one point.
And let's see what else. What other ones?
What do you think about? I'm gonna throw a couple at you and see if you would put them in top 5, top 10, top 8. Use of GLP-1s for men.
I think where it's needed. I'm not a proponent of everybody needs to be on a GLP-1, so I'm a little bit cautiously into that. I think it's really. I love seeing, active medications used for people who fundamentally need them, I'm going to tell you that there are a lot of people who need them, and it's like it has changed
It's a game
people's
changer for a lot
lives.
of patients, right?
Remarkable.
So you're
Now,
not opposed to it.
nope. I think it's tremendous. I think those medications are they're going to become even more targeted and have less of the side effect. My fear is side effects, guys. At the end of the day, the stance I take is that everything that we do has a potential side effect, and we just haven't really given the credit to what kind of side effects are going to manifest from these. But the nice thing is that it's advancing. It's like iterating like AI, so it'll get better.
What about peptides?
I think
Which
peptides are
peptides? How do you know? Who do you trust?
peptides is still the wild west in my opinion. It's showing like value. The problem with peptides that we see is that because of how they're created, and then because we don't know what the active agent like concentration actually fundamentally is, and the testing isn't there, that it's there with other medications, there's a potential that you could get differential behavior from different batches or different manufacturers. What I can say though is that knowing people that who have been utilizing some of these, like some of them are just absolutely insane kind of people's effects that they're getting. There's different ones that can kind of upregulate your neuroendocrine axis. They can be GnRH agonists, where you can kind of get increased growth hormone release endogenously by taking some. There are some that are better for your joints and soft tissues. I ruptured my Achilles and tried one of those. I didn't get the effect. But, I'm kind of, maybe then I was a negative Nancy and didn't even allow it to. But people swear by some of those things. And I think that, I think we're getting better. I think we as like a medical community and the whole regenerative wellness space, they're at this intersection now to where I think more people are more apt and open to it. So there's more like, I think there's going to be more and more actual data driven use of these things. And I think we're getting there. So I think they're all here to stay.
What about vitamins, vitamin drips, injections? Where does that fit in your algorithm for men?
I think for men, it's like I like objective stuff. I'm a harsh thing about you got to show me proof. And when I like things where you get, one of the things that you can get now is you can get really comprehensive assessments of what's up with your body. You can legitimately see, oh my God, you're deficient in this mineral. You're deficient in this vitamin. And listen, you mentioned vitamin. Most common vitamin deficiency in guys, vitamin D. So I'm a huge proponent of taking vitamin D. I forget sometimes, but it is huge. Like, why is it important? Vitamin D is a precursor to almost all the hormones in your body, especially the sex hormones. So, like, you could have low T just from having shitty vitamin D. So I think that kind of stuff needs to happen. So there is real validity in taking vitamins and specific supplements, but I think it should be data-driven. It shouldn't just be like, I'm going to take all this shit.
I love it. Really good insight. Prevention. Middle-aged man, they're doing all the right things. Are plastic surgeons becoming their primary care doctors? Where do they fit in this? Because they're going to see their wellness doctor that's in their aesthetic practice. Is that overtaking primary care? They still need primary care. Where do they go for? I know you and I asked you this because you and I have talked about this, and I kind of know your thoughts, but I want our listeners to kind of hear.
I think we personally feel an obligation that for us to get the best results for our patients, that they need to like be there. They need to be physically and emotionally and metabolically their best also. So it's in our interest to facilitate that, and hence why we have such an interest in the kind of wellness and longevity and the aesthetic space kind of being colliding into one kind of super specialty. And I think that that's our aspiration, to fuse those together and be that, that provider, that aesthetic, that holistic aesthetic provider. And sometimes I hate the word aesthetic because it sounds so trivial. So maybe we can work on that vocabulary.
But you're right. I think we need to take care of all individuals inside and out to optimize them to live their personal life the best they can, both with the way they look, the way they feel about themselves, and the way internally their body acts. Yeah. So it's a combination of it all.
Yeah, and that doesn't mean like us micromanaging all of it. That means us, handling a lot of it, also just working together with other people in the space, and us communicating better on a patient and getting them to where they need to be. the end of the day, I mean, like, I think all of us in healthcare, in kind of wellness, we just want people to live and be their best. And it sounds, aspirational, but it's so simple. It's so important.
Yeah, I would encourage all men to, seek out services. I would really encourage them to ask questions, right? Go do your research, find individuals, be it our practice somewhere else that you can trust, that are very trusted. Have these open and honest discussions with them, because there's ways we can help.
Yeah.
Surgery works really well, but there are alternatives to surgery as well. But oftentimes it's a combination of both that can get you to the outcome that you want.
And the other small stuff can make a big impact. And like, there's a point that happens, and it happens to all of us. Sometimes a certain day it'll hit you, and you might be looking back, looking at yourself in the mirror. You're doing something, you see something where you're looking, you're just like, since when did I start looking like that? And like, but you can take control. You can kind of intervene and dictate how it goes, instead of just being like a victim to it.
And I will say this to every patient: we're living, breathing examples of what we preach, because we're all doing the things ourselves that we're just talking about. We've had surgery. We're doing the wellness components. We do our neuromodulators. We do our fillers. Like, these are things, there's skincare. These are all things that he and I live and breathe and do every day.
We can't prescribe if you don't subscribe.
Which brings us to, please subscribe to our podcast.
Oh, yeah, true.
And, thank you for listening, being part of this. If you like what you're hearing, want to see more, please watch further episodes. Follow us on our social media platforms, IG, TikTok, and ask questions below. We're happy to kind of talk about any and everything.
All right, guys, don't be scared.
Be prepared.
Thank you for listening to HKB Uncut. If you enjoyed this episode, please subscribe to us on Apple, Spotify, or YouTube.
To book a surgery consultation or med spa appointment with our team, visit our website at hkbsurgery.com or head to the links in our show notes.